Welcome, my friends, to the Bob and Brad podcast. My name is Mike Keenitz, and today I'm interviewing Dr. Ray McClanahan, who is a podiatrist and works at the Northwest Foot and Ankle Center located in Portland, Oregon. He is also the creator of the Correct Toes Toe Spacers, which we will talk about later on in the podcast. Today, we're talking about foot health, how to fix bunions without surgery, heel pain, hammer toes, shin splints, and plantar fasciitis or plantar fasciosis, depending upon what you want to call it. If you are watching this on our main YouTube channel and would like to hear the whole episode, you can find it on the Bob and Brad Podcast's YouTube channel or anywhere else podcasts are streamed. So without further ado, here is Dr. Ray McClanahan. All right, we're going to get on the last subject of shin splints. So how do you fix shin splints?
Yeah, well, as you guys noted in your email, there are two types that we all see. There's the anterior type and then there's the posterior type. And both types, I seem to believe, are oftentimes related to overtraining early on. So think about the 2-a-day football practices. I don't know if they still do it that way. I don't know if the coaches have learned progressive adaptation or if they're still
they did when I was in high school.
Same. So 2 or 3, you're trashed by the end of the day. An awful lot of those folks will get shin splints, and it's not because they have any biomechanical issue. Definitely footwear plays into this too, particularly for anterior shin splints. And by the way, the podiatry community is now calling this tibial fasciitis as opposed to shin splints. What is a shin splint? So the anterior, in my experience and estimation, does have a lot related to what we talked about earlier. So these runners and walkers and hikers are doing their activities in footwear that has their toes above the ball of the foot, which again means that the front of the calf is going to contract. And this isn't just the tendons going to the toes. This is the muscle belly just below the knee. So some of our older runners, walkers, and hikers who spend their time like that and develop a foot like that will start to develop anterior shin splints. Because if you think about those shoe characteristics, especially the elevated heel, what's called your touchdown angle, where you come into the ground, measured from the flat of the ground to, so here's the heel, here's the ground. Elevated heel shoe, you're here a lot, as opposed to a flat shoe, you're bringing your foot in under your body. With an elevated heel shoe, your eccentric deceleration of your extensor group is sooner and longer. So I believe that's a huge component. So we get people out of the footwear that causes that anterior tightness. We do the toe extensor stretch, we do the mat pad, we get the flat shoe. The posterior, I think, is very much related to a lot of what we talked about today. So if you were to ask me what I think probably one of the more important joints in the body, it would be the big toe. Because what I do show everybody in the clinic every day, is I take their big toe and put it into bunion. And we already talked about what it does to the blood flow. We already know what it does to the small muscles of the arch. But I show people how their arch collapses, their tibia internally rotates, their knee is now in valgum coming to the inside, hip is internally rotated. So I think when we wear those shoes like that and our big toes over towards our second toe, I don't think our flexor hallucis longus or our digitorum longus, long muscles on the bottom, are adequately doing what they're supposed to do. And I think the load gets shifted onto tibialis posterior. So when I check these folks, it's probably like the folks you guys see. Their pain is kind of along the medial tibial crest. And so I get their big toe out, which helps flexor hallucis longus be more functional. I use a metatarsal pad to get the toes down against the ground and get the flexor digitorum longus engaged. And then we get them in the flat shoe gradually. I can't think of a client that didn't get better with that. Now, occasionally we see stress fractures, obviously. I treat runners, and I literally had a runner a few years ago. She had documented bilateral tibial stress fractures, and she would not stop running. And my good friend was her coach, who used to be a training partner. And so occasionally we see things that aren't anterior or posterior shin splints. And the big thing, too, you got to be concerned about, I know you know, is compartment syndrome in athletic population can sometimes masquerade as shin splints. But I think the garden variety is going to respond really nicely to everything we're talking about.
Sure. I know I don't have this on the questions, but I'm presuming footwear has a lot to do with ankle injuries as well.
It sure does. In fact, I cringe to think And I wrote articles in Walkabout magazine, and I've got articles on my website about, I used to make orthotics for everybody. And we've got a beautiful trail here in Portland. And sometimes the trail is like this, and sometimes the trail is like this. And what I had to learn the hard way is, as you know, orthotics are trying to supinate feet most of the time. Occasionally we'll make an orthotic to pronate people, but typically we're doing this to people's feet. So if they're out running on a trail that's like this, if this foot has an orthotic in it, I'm pushing them in the direction of an inversion ankle sprain. I caused this to happen to my former wife. Actually, we were on a trip over in Bend, and I had her in a pair of Asics, which had a bunch of motion controlling features, and I had an orthotic in there. And we started going down the trail, and sure enough, she inverted her ankle and sprained it. So I couldn't figure out back then why all my trail runners were coming in with ankle sprains, and now I know. They couldn't feel the ground. They were held constantly supinated or inverted. And the other thing about the toe spring and the taper is your fifth toe is supposed to be a lever. It's supposed to evert you. And if it's in under your fourth toe and you start to invert, there's nothing there to keep you from inverting. And we did a video on this mostly as it relates to basketball shoes, because obviously there's a lot of basketball players spraining their ankles. But so we get people close to the ground. We get them feeling the ground. We get their foot under their body when they land. Every once in a while, I'll be walking around here in Portland, and I'll see a lady walking in like a dance coat clog, which somebody told her is super healthy, and she'll step up on a curb and boom, she's down, and they don't know why. They think it's a good shoe, but then I'll show them the rigid wooden arch support, and I'll show them how their heel is 3 inches off the ground, twice as high as the ball of their foot, and they're constantly inverted and can't feel anything. Recipe for disaster. So I see very few ankle sprains these days, very few.